Welcome to the Clear the Winter Haze question and answer webinar. I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter. Today I'm joined by Mary Sue from my team. She's going to help with the question and answer portion, so go ahead and put those in the chat and she'll read those out to me a bit later when we get to that section. She's also going to give you different pieces of information in the chat and try to help you out where there is available information on the website. Um, my job today as your presenter is to do a couple of different things. One, answer the questions. Two, give you some different resources to help you. So I may reference back to our website as well. So what is our goal for this session? Well, our goal is to look back to the 1/27/26 session from Medicare Education Expo. This session has a variety of different topics incorporated within it. And so therefore we have questions that came in unrelated to some of those topics, but came in during those session registration, and that's what's here. So what we're really doing with this one is we're going to go over any pre-submitted questions from 127. Now, I want you to keep in mind that that's what the slide deck is built from. Once we get to the questions from this session, which is the second bullet point, those will simply be something I either read out or I have one of my team members jump in and help me out with, something like that. And the final section will be answer any chat questions. So again, if you have a question, feel free to put that in the chat. If it is something that I do need to take back or I may need more time to research, I will let you know that. All right, the very first question that was submitted is who to call for credentialing. Now by credentialing, I'm going to assume that you mean provider enrollment credentialing. If this is the correct assumption, then please call our customer service department. Their job is to answer the basic questions. Now, if you're looking for status of an application, they're not going to answer that question. Why? Because we actually do have two self-service tools that you can use. One is a national tool, and that is PECOS, the Provider Enrollment Chain of Ownership System. There's also EASY, and I don't remember exactly what EASY stands for, but we're going to look at that in just a moment. This is the application check. So you want to make sure that you're contacting those people to ask general questions, those people being customer service. Also using your electronic when necessary, okay? Now, also someone asked if they could contact someone in regards to a development response, and the answer is yes, and that person will list themselves. So you'll get a letter asking for information, asking for something regarding your credentialing, and then they'll tell you how to get a hold of them, whether it has to come into an email box or what has to be done. That's actually the person who's working on it and depends on the information they're asking for. But I will let you know that for the most part, they will give you a direct contact for how to get back to them. This is not a general customer service person. This is a direct contact for that application, for that issue. So you want to make sure you're well aware of that. Keeping that person's name and phone number or name and contact or name and email, I don't know what they're going to send you, does not mean you can use it forever and ever. Amen. Okay, keep in mind, most of those will go through customer service. One of the things I did want to point out is easy, and I just wanted to show this to you on the website because not a lot of people are using it or are aware of it. So here I am, and I'm on the WPS-GHA website, WPSGHA.com, and I'm going to use quick links. Now, there is a longer way to navigate to it, only why go longer when we can go faster? If you go in quick links in the left column, go down 5 items. You'll see EASI. This stands for the Enrollment Application Status Inquiry. Easy. You enter your application ID and your PECOS tracking ID, or your, I should say or your, not both. And then you can hit search and it will give you the application status. Now the PECOS tracking ID is the one that you would also use in PECOS. If you're not familiar with PECOS, I always recommend go to the topic center, come on out to provider enrollment, and look down the electronic provider enrollment internet-based PECOS. There it is, provider enrollment chain of ownership system. You open it up, you can read all about it. It does give links to get to the different information that you need, including the login screen for how to create an account, all of those different basic functions. So just a lot of general information on here, but I wanted to make sure you saw these basic pieces of information. Now on the CMS website, there's also a section which if you go to cms.gov, then you come to Medicare, you can find information on PECOS as well. Sorry, I'm just trying to find the correct selection, employment quality appeals, Medicare. Oh, it's the one that I'm already on, so I didn't really need to go near. Say enrollment and renewal, move over original part A. You can read through a bunch of different stuff. It'll help you through understanding enrollment and all the different things that happen with that. If you're looking for PECOS, I always am going to just start off with do a search. Okay, here it is. Manage Medicare enrollment with PECOS. Get you through it and links you to a variety of different things. So it really just depends on what you're looking for. You can see it is under enrollment and renewal and a variety of other areas. Now, PECOS is a separate website. It's not part of cms.gov. So if you're kind of trying to go to PECOS, please be aware that it will open or not for me. There we go. Go to PECOS and it will open in a completely different website. Looks completely different. So again, I wasn't really sure where that person was going with the question, so I'm hoping that is what you were talking about when you were talking about credentialing. The next slide is the IPN. How do I find the IPN information for other eligible payers? Again, the IPN is, we're going to assume from the CMS acronym list, it is the interparental nutrition, which is actually part D. It's not part B, so we don't have a lot of information on that. So what we did is gave you an actual website right here. And if you select it, it'll take you to the CMS website to the information they have for this. There we go. And it'll kind of walk you through it. Remember, it does say under Medicare Part D, so I'm not really sure what they were looking for with that, if that answers the question or not. The next slide, the next question we got is, how do I reach an appeal reviewer? Now, there's a couple of things you want to be aware of. First, you can't reach out directly to an appeal reviewer. An appeal reviewer at WPS is a level 1 medical review staff. They work with the redetermination department. So yes, they are either at level 1, they would be a registered nurse. They could also then refer it up to one of our medical directors if they needed to, who is a doctor. So how do you go through this? You have to go through customer service. They're going to field the questions. They're going to try to answer whatever they can. I'm not sure what you needed to reach out to this appeal reviewer for, so I can't answer that more thoroughly. What I can tell you is if you use customer service, they can move it up the tier system should it need to be moved on. And the tier system is specified in the Administrative Contractor Beneficiary and Provider Communication Manual. And it's section 30.3 or the triage. So it's really just a manual that tells you how we have to get to different things. Now, the other thing about that communication manual, when it talks about the triage process, please be aware that it also does then prohibit the use of, prohibit the CSRs from giving you general information, which is why in the previous one I did say they can't do that. I will go ahead and throw that in and have Mary Sue get y'all a link for that. So Mary Sue, can you look up the link for this manual reference for me? That'd be great. Thank you. So just keep that in mind when you're looking at what they can handle. Now, the reason everything comes in general through our customer service area is that they're the ones that track and begin the tracking process. The tracking process is required by CMS, and they have to then categorize what your call is about. That's why it comes through customer service, and then we work our way up the triage process. Next question, how do I check the appeals status on an appeal? The tracking ID never works. Well, I'm not really sure what you're trying to track with or where you're trying to go with this, so wasn't really sure. I will tell you the Secure Net Access portal does have a feature that you can track on. It's checking the appeal submitted via the portal. If you use that, Again, not sure where you're submitting, what ID, what you're trying to do with this, so it gets a bit more complex. And each level does have different things that can be done. So I'm going to ask one of my colleagues, her name is Karen. Karen does a lot of our appeals education, or I'm sorry, a lot of our SNAP education. She talks a lot about this system. Karen, is there anything that you can think of that they could do with SNAP that might help them other than, go to the manual and read how to do it?
No, I think that would be the easiest way. I mean, there is ways for you to submit appeals and also to search um, ones that have already been submitted. The tracking ID never works. You would be able to search it by like your provider, your MPI, things like that. So you don't have to use that number. There are other ways that you could search for it. So hopefully that would be helpful.
Thanks, Karen. So for all of you that don't know what we're talking about when we say SNAP or the portal or the user guide, we give you a little bit of information here. It is the WPSGHA.com. Right here in the top, you'll see a user login feature. This is available to you on any website. So if I go back to the homepage right there, I can go anywhere I want and it's still going to be there. When we look at this, what Karen and I were talking about, or what I was talking about with the directions, are in the portal user manual. From there, you can download the entire manual in a PDF format, your choice. You could also scroll down and look section by section through it. So when we're looking for appeals status, we come down and we look at, transactions. What are we looking for? Okay, under transactions, I need appeals, then I need, submission overview, all of that. And then you can check the status via the portal. This is probably what you're looking for here. Here you can check the status submitted by mail or fax. So it just really depends. That's why I was like, I'm not really sure how you're trying to check the status, what you're talking about with the tracking number and the ID not working. So I would follow these steps using the portal. If you don't have access to the portal, go back up to the top. It is free to anyone who works for a provider within the WPS jurisdiction. It uses the National Provider Identifier to indicate whether or not that provider has filed a claim to our system, and that's what you need to begin your process. But you can register right here. You can see I'm circling the second item from the left in under the user ID field. If you choose to register, again, it's a free account. Everyone must have their own account, but it will give you a lot of information. I really do recommend taking a look at this piece of information. Your next slide talks about contact information. I don't really know what contact information or even what contract this person was looking for. It was a very generic question. So the way that I chose to answer it is to actually come back to the website for a moment. The reason that I want to do that is to focus right here on this contact us feature. This is on the top bar. It's on our information. And you select contact us. Now, again, it does matter your line of business. Now, a line of business is designated by CMS. So let me just give you an example. J5A, okay, J5A means that you bill on a UB04 or an 837I and that you're in Iowa, Kansas, Missouri, Nebraska, or that you fall into one of the other providers that bill Iowa, Kansas, Missouri, Nebraska. But you're still billing on those two forms. So your home office happens to be there. You were enrolled with that previously. There's a variety of different features that function that. Then you say, okay, well, that makes sense. J5B is your 1500 and 837P billers in Iowa, Kansas, Missouri, and Nebraska. Then you also have these two. And these two are J8, which is Indiana and Michigan. Same thing. Part A line of business, UBO 4837Is. Part B line of business, CMS 1500, 837Ps. It does matter which one you select because you may get a different address or phone number depending. So I want to make that as clear as possible. When you select the contact, it's just who are you trying to get a hold of? What are you trying to do? A lot of what we see come in is actually into the customer service interactive voice response system, and then it just gives you the phone number. So very simply on this one, it's just a way of looking up a variety of pieces of information. If on the other hand, you were looking for CMS contacts, I always recommend going to cms.gov. Don't go to anything inside here, but go to About Us. It's going to be in the upper right area, but it's the leftmost link. So it's the left link next to the little search feature, if that makes sense. And then you can click About Us. When you click About Us, you'll open up a new listing and you go to Contact Us. And there you can find the contact database. You can find the contact CMS, you know, the different ways to contact CMS. So hopefully that makes sense to everyone and gets you what you need. Again, I wasn't really sure where they were going with contact information because it simply said, where do I locate contact information? And we really didn't know what you were looking for there. All right. Next, what's the best phone number to contact Medicare if needed? I will tell you the best phone number for us is available on that Contact Us page, and you will want to use basically the customer service. That's this page. Now, someone as part of it, well, it wasn't part of this question, but in addition to this question, did ask, if I receive a direct line, can I call that back for Medicare? And the answer is yes. WPS does on occasion send you a letter and say if you want to work with someone or you need to work with someone. Another example, other than provider enrollment, which we previously talked about, is the targeted probe and educate process through medical review. They'll have a phone number. That phone number connects you to the person who's actually working with you as your nurse educator. I'm not super familiar with the targeted probe and educate process, so I'm going to take a minute and see if Mary Sue or Jennifer would like to add anything. Again, they do know that it is about a certain provider, certain things like that. So Mary Sue and Jennifer as our clinical staff. Anything to add to that explanation?
Tom, thanks for asking. Yes, for the targeted probe and educate process, when a provider is selected, they will be assigned a nurse reviewer, and then that nurse reviewer will be their point of contact for the entire length of the probe review or the targeted probe review. And generally that nurse will, if they need to email you stuff, they will email. You'll have their email information, often phone numbers as well. They will provide education, as needed on a one-to-one basis throughout your process. So yeah, you will have someone specifically assigned to you. And I see that Kelly asked a question or kind of made a statement about the process is frustrating. And if there are additional questions, Kelly, that we can help you with, go ahead and place those into the chat.
Thanks, Mary Sue. So that's just kind of a good set of information coming from that. Just give Jennifer a heads up, Jennifer, anything, or were you okay with everything that's been said so far and good, don't have anything else to add?
I think Mary Sue summed it up well.
Perfect. Okay. So those are our two clinicians on the call, which is why I called on them. That's kind of what they talk about, not so much what I talk about. So I wanted to make sure I gave them that opportunity. One reminder that goes with phone numbers, we do want to occasionally get misdirected calls, and it's someone that gave a beneficiary or a patient with Medicare our number. The patient always has to contact 1-800-Medicare. That is their contact center. That's where everything goes through. 1-800-Medicare handles all patient inquiries. We will work with 1-800-Medicare as an affiliated contractor should they need our help to answer a patient question. So don't refer a patient directly to us. There isn't anything we can do for them. So hopefully I hit all the different phone numbers and the different things you might need to be aware of with that. The next question is, why is there such a short window for answering questions after an education event? And it's quite simply because we have time frames for reporting on our events. So in order to get everything done in time to get it to CMS, to tell them all the different things that we have to do and all the different information that needs to be there, we've assigned our time frame at 7 days. Now, the reason that we also do that is that then we can move on to our next event. So if you were to imagine I'm doing 4 or 5 events a month. If If I'm doing 4 or 5 events a month and I give everybody a month to get a hold of me, I'm trying to work my next set of events, but still looking back and trying to field questions coming in from a previous set of events, and a variety of other things are happening like that. So our job is to do the education. Yes, we do want to give you timeframes to submit those, and that's why we do give you the 7 days. But at the same time, I also have to be able to move forward and develop additional education and future education. Hey, what can I do for the website? What can I work on with this department? There's a lot going on underneath. The basic gist of it, though, is to make sure we get and meet all of our CMS reporting requirements, and then to make sure that we, as the presenters, have time to move on to the next presentation, the next set of information. I will throw this one open to anyone else on my team, unless y'all know something I don't know, but feel free to jump on in here if anyone has anything to offer. All right, let's move on to the next slide then. So the appointment of representative form, when do we use the appointment of representative form and why? The appointment of representative form is something that the beneficiary uses to appoint someone to act on their behalf. As a provider representative, you don't necessarily need to do an appointment of representative form. Why would you do that? You already work for the provider or represent their office. You tell us that by authenticating. So when you call in and we ask you a question and you can answer those questions, and then we say, okay, good, you go. That's what you're doing. You work on behalf of that provider. Now, an appointment of representative form is something different. The primary use that I know of for this is when a patient wants you to work on their behalf to get an appeal through the system. You may have additional information or other information. Maybe you're the primary care, but you didn't perform the service. The reason that you can't perform the service is that if you perform the service, then you're a party to the appeal already, so you don't need to be appointed to work on behalf of the patient. If, on the other hand, you're not, it's not your service, you didn't do the service, but the patient's asking you and you're willing to do that, they could appoint you as a representative for that process. Not really sure what else you're looking for from that, so I would recommend putting some information back into the chat. Hopefully that answers the question. I struggled a little bit with how to answer that one because I wasn't really sure where you were going with the appointment of representative form. The next one is the clerical error form, and is the clerical error form required when filing waivers? So let me answer this in a couple of different manners, and I'm going to give you a variety of pieces of information. First, the clerical error form is only required when it is truly for a clerical error reopening. The form is required when you do a paper reopening. It is not required when you do something through our portal. Our portal has a built-in form that gathers all of the information. So I guess you could do the form and upload it, but you're already giving us the same information and it's designed to gather that information. So I'm not sure what you would need to do that for. Okay, the clerical error form also is not used for requesting timely filing waivers. This is a letter that is sent because it is a separate section of the law that grants timely filing waivers, and there are limited exceptions. So you must explain in a letter to our claims manager, not using the clerical error form. Okay. Again, the clerical error is very much defined as a minor error. It's used very sparingly. Now, I will tell you that if you're using the clerical error feature, the best way to use that, or the best way to use this process, is if you are a Part B provider billing on a billing on a 1500 or an 837P, then yeah, you want to use the clerical error form when you're submitting for written clerical error. This gives you 12 months from the processing date. You could also just go in, fill the clerical error form out directly in the portal, and then you don't have to do all of that, and you can attach documentation and everything right there. So hopefully that answers the question. I know I probably gave you a lot of other pieces of information that went with it, but for the most part, when CMS uses the term waiver, we're not looking for anything that's a clerical error. It is done separately outside of the clerical error process on purpose. The clerical error is very, very much defined. So clerical error reopening form. Is the form ever needed if we're completing our request on the WPS website? Oh, I just answered this. The answer is no. No, it's not. The website has a built-in form that you fill out, so you don't need to attach a form plus this. For those of you that don't know the form that we're talking about, it's on our website, okay, wpsgha.com. And if you go to tools and you go all tools, this is the drop down on the top, kind of in the middle, and you're going to go to the second drop down from the left, and it's going to say all tools. Then I can go all forms. When I'm looking at this, there's a lot of different forms that you can use. So which one are you looking for? And you can read through all of them. I prefer, instead of trying to guess my way through it, I do the A to Z listing. Okay. So enrollment, Kansas development, sorry, got to find it, reopening. No, okay, being good. And so you're just going to find the one called this would be an Iowa one, but Iowa appeals clerical error reopening. Gosh, that gets really late. I apologize. Clerical error reopening. Okay, this would be your fax cover sheet. So are you faxing it to us? Then you want to make sure you have this on it. So it just depends on the form that you want there, if that makes sense. So you want to find any of the clerical error reopening. Now, I will always encourage you to use our cover sheets, use our information, and the reason for that is it contains specific fields that will help you. Without those specific fields, we are kind of stuck. And sometimes you get all the right information and it's great, no problem. Other times we can't do anything with it and we have to dismiss it because there's nothing we can do with that. So I want to make that why I really do encourage you to use those. I want to make that pretty clear. Use those if you can. Coverage articles. Should we follow an article with an LCD? Yes. A local coverage article is a coding and billing article. They go with LCDs. They do not go with LCDs all the time. They could go with an NCD, a national coverage determination. By the way, an LCD is a local coverage determination. This article is designed to help you understand more about the edits, audits, the system, and what it's going to do with your claim. So it could talk about, hey, bill these procedure codes with these diagnosis codes. It could even get specific and say, here's 4 procedure codes. These are the group diagnosis codes that go with that. Here's these 6 ones. Then you're going to use group 2 codes, which go with that. Could also be specific in terms of add a modifier, and without that modifier, this is what will happen. So yes, you want to follow these articles. A little bit more about where to locate them, which is the other portion that's not on here. So I just thought I would show that to you. If you're trying to search for a specific article, again, you can use the quick lookup here. This is, again, just a code quick lookup tool. The actual tool itself, if you want to see the full listing, is to go to tools, go to all tools, or actually you don't even need to do that. Go to tools, and then the second item in the drop down says LCD and article lookup. This will provide a list of information, and you can search for any of this that you want. If you happen to know a policy that it goes with, awesome. Select the policy. I'm just going to pick this Moldex breast cancer assay, and we're going to open it up, look at it. Awesome, awesome. Scroll down to the bottom. Literally look away if you don't like a fast scroll. I'm just going to drop this down to the bottom. When I get down to the bottom, you'll see related documents, and here's a billing and coding article. So hopefully that makes sense. Now, again, let's look at this billing and coding article because you're asking if you should use it, and the answer is yes. If you scroll through, you'll find out, okay, this is where our national coverage information, this is some article guidelines. Here is some CPT codes and things you have to know, including where you have to enter information on the claim. So this is what you're looking for, what our system needs to get this claim processed. Isn't that what you want to know? So why wouldn't you want to follow it? And again, this one's pretty simple, which is lucky because it only has 1 procedure code, and then it has a list of ICD-10 codes down here. That's not actually a terribly long list. So we want to make sure that you're well aware of that. On the bottom, on the other hand, you can come down here and go back to the policy too. So there's just a variety of different things you can do with that. If you choose not to use our website, I'm going to bring you out to cms.gov. You've seen this website a couple of different times. You can search for the Medicare Coverage Database, or MCD. You can locate it through navigation. The fastest way is just to put MCD, or Medicare Coverage Database, in the search. By hitting enter, you'll be brought to the lookup, which is super easy. And it brings you right here, and you can start your search. So you can search for a procedure code, you can search for a diagnosis code, you can search for a keyword. I'm just going to use the word foot, just foot, but I don't want it for all states. I'm going to select the state of, well, I came to Indiana first, so Indiana it is. If I hit search, it'll give me a variety of different things down below. If I hit search this way, it will actually bring up a variety where it gives me more fields up here. So I can say I want Indiana, but I also don't want all contractors. I want by contractor name, WPS. I'm going to apply that. And again, there's just a little bit more, and it's just going to keep narrowing the search down. So here you can see an article, but we don't have a foot care LCD. That's because the information that goes with this is actually in the Internet Only Manual. So again, yes, you want to follow this article. It'll talk about what needs to be done within the system. Okay, this is a reference. This is not an LCD reference, local coverage determination reference. Instead, if we scroll down, it's going to tell us, here's the national coverage area where we're getting it from. Here's what you have to know. Okay, and you can see right here, it's giving you references and everywhere you have to go to get this information. So I do encourage you, take a look at the articles. If it is available, we definitely want you to use it. On the next slide, I'm not super familiar with the prior auth process, but I will let you know that I know that an 85X, which is a type of bill on a UB04 or an 837I, is not applicable for the outpatient hospital because it's a critical access hospital. The types of bill that is applicable is a 13X. Again, here I'm going to rely on Mary Sue and Jennifer. Anything else to add?
Hi, Tom. I don't have anything else to add.
Okay, thanks. Again, just keep in mind when you're looking at it and you're saying, I'm a critical access hospital, what do you bill on? And the answer is an 85X. No. Right now, outpatient hospital, which, yes, that is a prior auth program, is only available for the 13X. Okay, 13X. We did get and clarify this question in particular. So I'll read you the question, and then we're going to talk more about that. Why are WPS medical review and appeals staff not recognizing or accessing documentation uploaded via ESMD? We've had claims RTP deny an unfavorable appeal decision when the documentation was uploaded via ESMD. So the first step that I did is went back to this provider and said, give me some more information. I need to know more than just general. So they did, and we went back, and then we were able to take those numbers and go back to our internal staff. Yes, the information they sent was there. They could see the information in ESMD. Here's the problem. The denial isn't because the information wasn't there. Instead, the denial was because the information was not complete. It did not contain everything they needed to make the final medical review decision. So that's why you're having the issue. Now, that is for the situation that they sent to me, and then I specified back each one to them. So I wanted to make everyone aware. ESMD is a great tool. It's something that will help you, and you can upload medical records through that. You can also do that through our portal. Our staff will access either one, but just because you uploaded medical records doesn't mean you uploaded the entire documentation that we needed. If you miss something, we will still either return to provider or deny. It just depends on what you're giving. You may get an unfavorable decision. Look, it stands as it is because we don't have what we need. So there's a variety of things that can happen with that. So this one, we did email directly back to the person. We did that because we needed specifics from them. Federally qualified healthcare centers, and they're new to the federally qualified healthcare centers, which means that they're newly enrolled as one, I'm assuming. And they want to know if they have to bill on the UB04 claim form. And the answer is, well, how are you enrolled first? So if you're only enrolled as a federally qualified healthcare center, of course you do. It's the only way you're going to get paid. On the other hand, some federally qualified healthcare centers will still choose to enroll as a Part B provider, which means it will allow them to bill on the CMS 1500 claim form or 837P. The catch is they're not paid under the same all-inclusive rate. So it's not their per diem rate that they're going to get paid under. If you bill on the other form, the 1500 or 837Ps, you will be paid based on a fee schedule or whatever the appropriate payment is based under the Part B side of the house. If you bill on the UB04 or the 837I and your billing is the federally qualified healthcare center, which you recognize as the type of bill, then you will be paid under the air. So I'm not really sure where that person wanted me to go with it, and I'm not really sure if I went where they needed me to go. It's not that you can't be enrolled as both. That's not what we're saying. We also want to make sure that you're well aware of it. Okay. So that is my last submitted question that came in for the 127 events. All of them are done now. What we're going to do is begin questions that came in as part of this event. So I'm going to put the survey slide up, but I'm going to continue to talk. Okay, going to continue to talk. First question that we got in as part of this specific event is a specific J code loaded for payment? I don't really know because it depends on the J code and it depends on what it represents. So I just gave an example, a J3490, which is a miscellaneous code unclassified drug. It's administered by an injection. We get that, but what's the drug? That's not loaded for payment. That is actually priced by an individual who then has to look at the information on the claim to make sure you gave us the drug classification, all the information we need to process that. So while we may translate it to a drug very close or similar or whatever you want to say, it doesn't have a specific pricing. That is how J codes work. If it does have a specific price, it would be available on our website, but for the most part, they don't. The next question that you asked is how the WAC has been loaded for a new drug, and the WAC is the wholesale acquisition cost, WAC. I love the acronym there. To do this, though, we do need a bit more. This is too general of a question. The new drugs, again, are translated, used, and looked for under different drugs. There's a variety of different things that are used with that wholesale acquisition cost, and then it's obviously driven down a bit more as it becomes a more common drug. Next question. Is Medicare processing claims for providers who are impacted by the Change Health cyber attack? Because a lot of our claims denied for timely that couldn't be filed due to the shutdown from the Change Healthcare cyber attack. So we're unable to do an appeal. Is there a way to have these reviewed for possible payment? Now, if you are getting denied for timely filing, this is not an appeal. Please, people, stop doing appeals on this. They are automatically dismissed. On the other hand, timely filing is something that you can request a waiver for. The waiver is a timely filing waiver. Let's go to our website for just a moment and we'll talk to you more about that. So you can go to claims, which would be topic center and claims. Once inside there, I don't like to try to scroll through. Another way to do this, and you'll see me use different ways, is to type timely. Okay, well, what do we got going on here? Well, I can do claim submission, fee for service, time compensation, probably not it. Professional services or deadlines. Hey, timely filing for a claim. What this will then explain is if you're in part A or B, what we want to look at, and it'll walk you through how to file a claim. Now, keep in mind, filing a claim for under the timely filing waiver guidelines is very strict. Medicare does have certain guidelines that go with it. So you want to make sure you read the information. Here's the couple of things that also need to do. One, the waiver is a written letter, a written request to the claims manager. The claims manager must then read through the request and determine whether or not it meets one of the exceptions. If it does, it can be granted. We still must have all of the paper claim forms in the proper format. So either the UB04 or the CMS 1500, they got to be in the pink, white, red, white, whatever you want to call that format. And everything has to be properly done on those forms in order for us to override this edit. So I can grant you a timely filing waiver, but if I have no claim forms with it, it's not going to do you anything. So this one is a little bit more interesting, and we want to make sure that you're following through with this article. Again, the reason that it's giving you Iowa, Kansas, Missouri, Nebraska down here is because that's where I'm at up here. So if I were to just simply say, okay, this is applicable to everyone, and I flop over to J8, which is Indiana, Michigan, and I scroll down, suddenly I get different addresses. All right. Next question. If we signed up for an immediate recoupment but want to change it back to not have the automatic recoupment, how do we change that? So let me first of all start off with immediate recoupment and what that is. So if you receive an overpayment request, you can ask us to automatically take money back. This is done through a form or online. Well, I guess we'll just go to the forms. It'll be the easiest way to do it. So overpayments, tools, all tools, scroll down to all forms. And what you're looking for is a form that's going to deal with recoupments, immediate recoupments, immediate recoupment right here. And then this just explains a little bit more about it. Now, an immediate recoupment of one claim versus all claims. So you want to make sure you're getting all the information filled out correctly. If you need help with any part down here. If at any time you want to revoke this, we must have a written request to revoke it. There is not a form to say I don't want to do this anymore. So there's forms to say I want to do it, right? You can fill all this stuff out, but I guess there is an option on this one that says I can discontinue. So let's use that. Sorry, I misspoke there. There is an option on here. So you want to come out to the immediate recoupment request. You're going to select the option that says I want to discontinue. That will stop all future recoupments from occurring. And then you fax that in or send that in, we'll get that available to you. One thing to note is it does have certain designations of people that can sign this. We've had issues coming in with the wrong signatures. This signature must match someone within PECOS so that we can actually track back and forth. So I want to make sure everyone's aware of that. Okay. All right. Here's one that was an interesting question because I'm not really sure what they're referencing, but it was, why does it take so long to get recoupments done? I'm not sure what you're referencing, but I will let you know that we do have 60 days to request an overpayment. So when we find out about it, it's not like we immediately send you the request. We do have a time frame to work it. If you're talking about the actual recoupment, we can't start taking that back until day 41. So the offset won't begin to be taken back even if you don't respond until that. That's a CMS requirement that goes with some of the other laws and the other actions that happen. I'm not sure where you were going with it or what exactly you were looking for. What is the process for voluntary overpayments? All right, let's jump back to our website. We'll talk a little bit about voluntary overpayments. Go back here. So when you come out, go back to all forms again, and you come back out and you're looking at overpayments. You can do an overpayment notification and refund form. This notification and refund form explains what it is. I'm going to tell you that we have this form on the portal, and we're asking you to use that because it's way easier than doing this in paper. So take a look at the portal, which is up here, and do the overpayment notification. If you don't want to do that, then you need to follow this form, okay? Select the specific reasons, all of that. Here's the directions for completing the form. Stop and take a look and make sure that you entered the top 3 fields: contract, type, and state. This right here drives our mailroom to make sure it goes to the correct contract so we can process it timely. So remember I said what takes so long to reprocess? What if you didn't enter any of these fields? Now we've got to stop and figure out where it goes from. Or what if you said, yeah, I get that it's J5, but I didn't enter part A or part B correctly. Because remember, part A is a line of business, not a service type. Part B is a line of business, not a service type. So part A is anything built on a UB04 or an 837I. Part B is anything built on a CMS 1500 or 837P. So you want to make sure you're selecting the right one. This one is the one that's just most often not even done, right? So we want to make sure we do this. A state is the, let me go back. I forgot what the state was. I apologize. The state in which the services, where the services were performed. So you want to make sure we incorporate all of that. That way we know it's Iowa, Kansas, Missouri, Nebraska, but it's Iowa in particular. So that again does help get it sorted correctly to the right batch areas and the right everything to help us get it processed timely. If you don't want to do it on here, if you come to the portal user manual and you scroll down, and again, I'm just going to scroll down because you can see all the different sections here. We got to get down to transactions again, overpayment claim adjustment rate. Oh, I'm sorry, transactions, claims, then overpayment claim adjustments. This is the actual header. You can do the overpayment claim adjustment right here. What's great about doing this, and even sometimes you can even open a claim and you can select, oh, I want to do this in the claim. What's great about doing it from there is it auto fills in a bunch of that information and it can't really mess it up then. So some of the missing fields that are creating some of these delays wouldn't even be an issue because you've already done it in the system and the system auto builds that in. The next question, is it okay to adjust a claim to correct an overpayment? I'm going to assume you're a Part A biller billing on a CMS 1500 or an 837P, and that this is coming through DDE adjustments. And yes, that's fine. What it will do is actually correct the claim. Now, sometimes this will happen and it'll be like, but without that information, I can't do anything with that claim and I can't process it. And so that will go to RTP. In that case, you do need to do one of the paper forms. So it just depends on what you're doing. Now, on the other hand, if you're saying, hey, I'm going to adjust a claim and it's a 1500, this is done, I'm sorry, 837P or 1500. This is done through the clerical error reopening process here on our website. This one's great because it'll just straight out tell you you can't do that. It won't take it. So I want to make sure you're well aware of that. Okay. So again, I did it, hopefully just address this, but it says that we sent a corrected claim and it got stuck in RTP. Again, if that corrected claim makes it so that the claim can't process, and there are certain pieces of information that we would have just straight out RTP'd in the first place, except here's the problem. You sent a corrected claim to adjust the original claim, except the corrected claim is now missing something which causes it to return to a provider. Then you do need to use the paper claim form. If we do an avoided claim for a service, will this initiate a recoup? Now, again, I'm going to go back to the basic answer of I'm going to assume this is direct data entry and you're voiding a claim, which is a UB04 or an 837I. And yes, this should initiate a recoup. If the claim is paid, remember, sometimes when you void a claim and it's not paid, such as it went to a patient's inpatient Part A deductible, you're voiding the deductible amount, but you're not actually affecting a payment that happened. So there's a variety of different things that can happen with that. This one, I'm not really sure where you're going with this one, but why isn't there more detail about why the overpayment occurred? I'm not sure what you mean by that. The details are provided in the letter that is sent to you. If you need more information or you don't understand, then contact customer service. Be specific when you contact them. You are asking questions about why. I don't understand why. You're not asking general status on the overpayment and things like that. The reason that we state that is if you can get the data from a self-service tool, it is expected that you would use that self-service tool. Our next question is how to stop overpayments. Well, let me just put it this way. If you owe the federal government money, you're not going to stop us from taking it back, just like if you owe any other federal entity money. If you mean you don't agree with an overpayment and you want us to reconsider the overpayment, that is done through the Medicare appeals process. Many of you all are familiar with the claims appeals process. It is the same process, except don't appeal the claim, don't appeal the claim decision. What you're actually appealing is that you owe the overpayment amount. And with that said, use the date on the letter to determine your 120 days for the initial request for an appeal, which is the redetermination or level 1 request. So take your overpayment letter and go 120 days. That's how long you have to file that initial request. So there's a lot of different factors that go into that. The next question relates to a 30-day increment, but I wasn't entirely sure what 30-day increment you were talking about. It did come in with how do you stop an overpayment. So let me just make an assumption and we'll go from there. So during the appeals process, there is a reference to what's called a 30-day. I apologize for that. And that 30 days is that if you file the appeal within the first 30 days of receiving the letter, we will not take money back on day 41, as I previously stated. What we will do is wait for us to process the redetermination. We will then send you a letter. If within the next 30 days following that letter, you file a level 2, we will not process or take money back until after that determination is made. So I think that's the 30 days you're referencing. Some people refer to that as an 835, but that's just a section of the law that put it in place. There's no like really solid name for it. Please remember that if you're referencing or if you're doing an appeal and you didn't pay the money back and you're trying to use that 30-day process, it's great. We aren't going to take the money back, but interest would still apply should we uphold our original decision. So it's not as though the interest goes away. The next question is, what happens if I have an overpayment on an old claim and it's not in the system? Now, this particular question was asked by a CMS 1500 or a 37P. You'll have to contact customer service. It can be drawn back into the system after a period of time. We know that. Through GDE, they can do that for the UBO4s and the 837Is. However, the 1500s and the 837Ps, you cannot. So along with that, it says, how far back can we take an overpayment for? Great question. And in general, the overpayment goes back between 7 and 10 years. Now, we say in general because once you enter into certain things like fraud and abuse investigations in which there's a law enforcement request, that's not established by us. That's the federal court system. They'll tell you how long they can go back for and whatever they're doing there. So in general, it's 7 to 10 years. And we say 10 because MSP can go back, Medicare secondary payer can go back 10 years if you do not keep your questionnaires or your questions that you ask the patient on file for 10 years during an audit. So it's just a lot of information for you guys, but that's how far we can go back. So what do you do if there's an overpayment on a claim, but the claim is outside of timely filing? Don't appeal the claim. Appeal the overpayment. If you disagree with the overpayment, that's what you want to appeal. Start there. Again, you have 120 days to do it, so take advantage of that. Here's why this should not be an overpayment. Here's why I should not owe you this much money. And go through the levels and the steps that go with the appeals. But again, being very clear that you're appealing the overpayment, not the original claim decision. The original claim decision didn't change just because there was an overpayment. What did change is that something happened after the fact for additional information to come in, which caused that. Okay, that's why you're given 120 days from the date of the overpayment request. This one was kind of generic and hard for me because it just said T status. We also have hospitals in Kentucky and Illinois. Awesome. T status is returned to provider. It's done through FIS, the Physical Intermediary Standard System, which is done on a UB04 or an 837I. I don't know what T status it's in. I don't know what the code is that goes with that. Each return to provider has a code that's assigned, and that code is what you have to look up to figure out what's wrong. I do want to see if anybody on my team has more information than that on T status. With it being such a generic question, sometimes other people have different thought processes. So does anybody have anything to offer? Okay, next question. What are some common errors with dealing with the appeals request? This is a great question. First, and this sounds very simple, but send the appeal request to the correct level. If we've done an appeal at level 1, a redetermination, we can't look at it again. So you must move on to the reconsideration. That's how it works within the Medicare appeals process. So number 1, make sure you go to the correct level. Are you doing a reopening? Are you doing what are you doing with it? You send an inquiry to appeals asking questions, but really you're trying to do something not related to an appeal. And so we read it and we're like, wait, they're not trying to do that. Okay. Also for appeals, did you file them timely? And the reason that we put that in is some people do miss it because the appeals do have different time frames. Let me go to cms.gov here. I'm actually going to go to Medicare Education and Training because I think this is a great way to see a chart for it. Now, the official information will be under Medicare Education, and I get that, Medicare, and then appeals. But Medicare Learning Network, if we go to that and we go to resources and training, we can scroll down and we can open a publication. And if we type appeals, the reason that I like this one, if you're really looking for that fast information, is this appeals booklet. Should open in a PDF. There we go. So you bring you to the highlight page and then you can actually download the PDF. And when you scroll through this, it's going to give you some basic information. But what I like about it is it does go through all your time frames. Okay, here's an appointment of representative. So if you have questions on that, I want you to read this section. Okay, we'll answer those if we have a little bit more time, as I'm just scrolling down. But see how it gives you, okay, here's what I can do. Here's what's going to be dismissed. Here's how long I have to file it. If you miss this 120 days, it doesn't reopen. It doesn't get to restart. It doesn't get to change something. Same thing with 180 days. Same thing on a level 3 with 90 days. I'm sorry, 60 days. Sorry, I said 90 and that's not correct. It's 60. So each one has certain levels and each one has different time frames. I know that's confusing. I do understand that, but that's why I like this booklet. It'll get you through what you need much faster. And then you can come down, and again, this is on page 18 at the end. This is that chart that I was talking about. How long does it take to decide? When must I file? 120, 180, 60, 60, 60. We have 60 days, 90 days, or 180 because it depends. And then again, 90 days or 180 because it depends. And then in the federal level 5, there's no set time frame to complete it. So you want to make sure that you don't miss anything in this column, the 120, the 180, the 60, the 60, the 60. If you miss any of those, your appeal rights are done. They don't go back and say whatever. You can try to file an appeal, and by try it means do the exact same thing as you're going to do to file it. But then you must also ask them to extend this 120-day deadline or 180-day deadline, and you must provide a full written explanation as to why you believe we should waive that. So just don't miss them in the first place. It's a lot easier. Okay. Some things else that work with that don't work with appeals. When people send in something related to Medicare secondary payer and you're trying to appeal that, if that's a denial, that's not an appealable denial. Next issue, missing key information. So we go to do the appeals request and you didn't put the provider number on there. The provider transaction access number, the national provider identifier, is we can't do anything with that. We need that information in order to do anything. So missing key information. Now the key information is CMS required information. So that's also going to be in this booklet. The next item, it wasn't signed. Sounds very basic, but you know that Medicare requires a signature on everything. The last one is a duplicate request, and this one has become more and more common for us because people are not following how long does it take. They're saying, hey, we didn't get an answer in 30 days. Well, as a matter of fact, they're not actually doing anything. They're using AI to do it. And AI is just automatically resending the appeal. Well, okay. We weren't even supposed to answer in 30 days. We can if we're caught up and if everything, yep, great. But we don't have to. We have 60 days. So we get in a lot of duplicate requests. The other problem is people say, oh, I want to file an appeal. Awesome. And they file it on our portal. Great. And then they file a paper request for the same thing. Well, that's a duplicate request. The more duplicate requests we have to sort through, the longer it actually takes for us to work your stuff. We are meeting all of the CMS deadlines. It's not that we're not meeting them, but I really did want to bring that into it. Okay. So those are what I know about the appeals request and making sure you're getting all of those different pieces of information. The final question that we actually had pre-submitted was about telehealth billing. Now, that's all it said. And I am going to tell you that we have some telehealth education coming up on 225 and 226 because telehealth billing is not small enough for me to fit into this time frame. I will give Ashley the opportunity, and Leanne, I'm not sure if Leanne's even on, but give them the opportunity in a moment to talk about telehealth billing. Also give Mary the opportunity if she happens to be on, and she can talk about mental health telehealth billing. But before I do that, I just wanted to show you that if you come to our website, you go up to the top in the middle, go to the training center. Now, a lot of you may link directly from our e-news or from other places to get here. This is the actual way to get to our live events catalog. And the ones I'm talking about, the two events that I'm really going to encourage you if you want the information on telehealth, come to the 25th and 26th. Those are two of them. Now, I'm not sure when telehealth, 319, thank you. I was just going to say, I'm not sure when that one's available. So 319 will be telehealth for mental health, which because mental health has certain criteria and waivers and other things that are a little bit different, we do some separate telehealth for that. That'll be on March 19th. The registration for that should be opening pretty soon. My guess would be maybe by Wednesday of this week or next week. And you'll see that listed here as well. So it just depends on when we get everything caught up. Oh, Mary, I'm going to let you just mention whatever you put in chat there for me, if you wouldn't mind.
Sure. Hi, everyone. This is Mary Milko. We've been watching what's been going on with the Consolidated Appropriations 2026 bill, and it's my understanding, based on some breaking news that I just read, that Congress has now approved the bill, and it is on to the president, who said he will sign the bill right away. Keep in mind, we do need to wait for CMS to provide directions to the MAC, but as soon as CMS does that, we and all of the other MACs will get you the latest and greatest on telehealth. Those flexibilities and extensions will not, or they are being continued on through, I believe, the end of December. But we will send you official notice as soon as CMS has provided direction.
Thanks, Mary. I do want to open it up to Ashley and Leanne and see if they have anything else they'd like to add on telehealth.
Hi, Tom. This is Ashley. Just to kind of reiterate what Mary just shared, once we receive that communication from CMS, Leanne and I, will incorporate that into our two-part series that we have coming up, as Tom mentioned, at the end of this month. So stay tuned. Hopefully we have that information from CMS, and we'll share that once we have it.
All right. Thanks, Ashley. Oh, I'm sorry. I don't even, just looking, I don't see Leanne on, so She's obviously, we're not going to hear from her today, but remember that if they don't get it in time for the education, they will provide education. These are scheduled events and you can register today. I would recommend doing that. The two-part series is just, it's a really nice format to get the information. And again, remember mental health and the specificities that go with that will be coming in just a little bit. So just a lot more to come on the two-part health. Our two-part telehealth series. Wow. Um, Before I leave everybody here, I want to do just a couple of quick things. And Mary Sue, this is the time that you'll want to prep if I have any questions in the chat. But before I do that, I did have a couple of comments, and they were general comments. I thought they're probably good things to go over. Someone asked about in the training center this encore presentation page, and why do we not have things out here forever? Well, our basic answer is first, if you look at the amount of education that we do each month, this list would become long and oversum. Okay, so we know that I can go through and look at this. We typically remove it once it reaches 60 to 90 days old. We don't remove them on the first, so it's not like, oh, this automatically gets removed on this day. That's why we say 60 to 90. So you can see right now we're out through December, and then if you scroll back up, you'll see all of January. What happens with this is, yes, we do have a player, and yes, you have the downloadable material. I want to remind everybody that even if you want the presentation and you're watching this and it's no longer on here, we do give you our email address. So email us. But what are you going to reference when you email us? Let me just see if I can get this one to open. So this is our YouTube channel. On our YouTube channel, I'm going to use this playlist, and I'm just going to search the Encore playlist. I could search any of these, but inside the Encore playlist, Encore presentations, it'll open the first one, but it'll then give you a whole list down the side. Okay. You're going to reference whatever this title is. Hey, I watched your Encore presentation for snowdrifts and website clicks. Can you send me the presentation for that? If you want to scroll down further, and keep in mind, this one's pretty big. There's like 400 and some videos on this, but it's just a way to look at it. You can do this with any YouTube video that we have available if we have a presentation for it. So if it's an encore and it says this is a recording of, you can see right here, this will indicate that it's an encore. Other times you'll just see something and it's a very short video, maybe 4 or 5 minutes. Those videos don't necessarily have a presentation because they were developed as videos. So to that, hopefully that makes sense. I'm not really sure what else you were looking for with this page. So let us know if you need more information on that. Another thing that has been asked about in the training center is to scroll down and what type of information do you guys actually house in here regarding the POAG? Now, the POAG is the Provider Outreach and Education Advisory Group. It's right here in the middle. This is a group of providers that actually advises us on our education. Sounds kind of weird, but it is true. What do they do? What advice do they give us? Well, what should we look at? Hey, do we want to change our handout? Do we want to do this? What type of education? Now, we don't necessarily say, oh, the data shows, so we're going to educate on that. Well, no, because that's coming from data. So there's a variety of different factors that figure into that. One more item. If you want us to speak to your organization, this is always something you can do. Now, these are professional organizations, not individual companies or individual organizations. So you can ask us to partner with you. And again, I'm in the training center and it's just partner with us. And then it just kind of goes through what we can do for you. So right now we can't do any face-to-face travel. It's not currently available. That's a CMS restriction under the Department of Health and Human Services, but we can still offer you a variety of different forms of partnership. We can come out and speak to you through a webinar, through a teleconference. We can do actual video. Mary Sue and I have done videos for people where they've played them. We've also done some written materials, so you need an explanation of insert and you want to know more from what the MAC will do within our audits and edits. It's a great way of doing that. All right, so that's what I had to go through there. I think that finishes up all the comments. Mary Sue, do we have anything in chat that I have not talked about?
Tom, no, there's nothing additional in the chat that you haven't talked about or that Mary or I have not answered. Some were very specific questions that we took care of. And I am just scrolling back through again, and I am not seeing any. And if you want to proceed on, we can stop one more time at the end if anything comes in.
Perfect. So a couple of things. There's a survey that's going to be available. You've probably seen Mary Sue put this way at the beginning, but in the chat, you've probably, if you've ever attended any of ours, you've seen this little pop-up box that appears. It's not spam. It's not malicious software. It's nothing like that. It is an external CMS survey. It does have a short and a long version. By that, inside there, it will ask you if you want to give additional feedback. Otherwise, it's 4 or 5 questions and you're done. But I do recommend that you take this. This really helps CMS gauge our education. 1, did you like this education? 2, how are we doing as a MAC? Those are 2 of the primary questions. Would you attend in the future? A couple other things. So really take this survey. You can take the short version, great. If you want to give additional feedback, go ahead and check that box and go through that. Couple of ways you can do this. Again, I will have Mary Sue put a link directly in the chat for you. That's coming out soon. Also, along with the link in the chat, we're going to incorporate this in the thank you for attending email. Now, the thank you for attending email comes out in just a few moments. I'm talking a little bit more about that, but there will be a link within there, total link within there. Also, you guys may see this online survey picture right here on a YouTube channel. There's going to be sometimes a little info button in the upper right corner. Either one of those will link you to the survey. Our goal is to get you to the survey and to get as much feedback as we can. So I'm really going to encourage you to do that. The last field does have an open text field where you can leave us a message of whatever you want to say. Okay. Let's go through some closing comments and then we'll come back to Mary Sue for questions. All right. So first closing comment. You will receive an email should you have registered with your email. If you did not give us your email during the registration and sign-in process, you won't get an email. In that case, I'll tell you about that in just a few moments. But if you do get that email, please take time to open it and look at it, especially if you need a certificate, which is then given to our governing body for continuing education units. We don't offer CEUs, continuing ed units, but the governing body does recognize our contact hours in a lot of cases, so you want to make sure you keep that email. If you think of additional questions within the next 7 days, again, you can email those questions. You're going to put Q&A webinar. That's what today is. It's all about the Q&A. So make sure that you get any of those additional questions in there. If you called in, which means you did not give us an email and you need a certificate, I need you to enter the email, put Q&A webinar, and in the body say, I called in with my number, here's my phone number, and it needs to be 10 digits. It has to be 10 digits. We have to be able to verify it. If we can verify your number, then we will issue you a certificate. Once again, that email is wps.gha.education@wpsic.com. Okay. Follow up for the next 7 days, including whether or not you called in and you need a certificate. If you did, send us a follow-up email. So if you want some additional questions, clarifications, whatever, feel free to put that in there. Let me help you out with that. But what we will do is send you a response. Now, I will tell you that if you send me something that has a document control number, an internal control number, a claim number, those are not items we're able to answer. Those must go through customer service. Remember, I talked about the fact that CMS requires certain tracking elements and requirements. That's where we get that from. Okay, so please make sure you're well aware of that. All right, Mary Sue, back to you for a moment. Do we have anything that came in that you would like me to answer?
Nope, I think we are good. I did ask one person to send something in that we were having, some back and forth that'll be coming through the email for you. And otherwise, no outstanding questions that you have not answered. All
right, well, thanks everybody for attending. We do appreciate your time. We'd like to encourage you to, again, register for those additional education, especially those of you that had questions on telehealth. Like I said, I just didn't want to get into all of it with some of the different things going on. And again, with that law that Mary just mentioned. So there's just lots happening going on. So again, register for our live events. We do want to continue to help you. On behalf of myself, Mary Sue, all the Provider Ocean Education team, we want to thank you for participating. We do look forward to your comments, and we hope that you'll join us again in future education. Thank you. You may disconnect.